Hello and welcome, Dr. Fiona Bull from World Health Organization, Stephen Fevrier from the World Trade Organization. Thank you guys so much for joining me. This is a unique conversation, and you guys work very differently to a lot of the other guests, which is phenomenal. It's very powerful as well what you're both working on a global stage. So I'm excited to be able to share what's happening, and then how do the rest of us that are outside your roles impact and add value, and ultimately, align to what we want to happen in the world. So this is going to be super. So maybe we'll start first with Fiona. Connect the dots with us first, please, in relation to where you started to where you are today. How did you evolve through your amazing career?
Well, thank you very much. Good afternoon, or good morning, good afternoon, good evening to everyone. I'm based here at Geneva in the WHO headquarters, but my journey to get here is perhaps a little unusual. I'm not a doctor of medicine. I'm actually a doctor of public health in the prevention of disease and the promotion of health. But my career started as a physical education teacher, which is a long time ago, but it was my passion and I succeeded. I trained in England, but very quickly saw the links between physical activity, physical education, health. And I went on to work in community health and fitness at the YMCA in London, and then decided to do more of the science and went as a focused of physiology and how do we measure and build fitness. And then got interested in the psychology with really when it asked why people don't do it if it's so good. So I then melded physiology and psychology and then met public health, which is how you do that, not just with an individual as a doctor or a health worker does, but whole communities and whole countries. And so I did my PhD in public health back in Australia, and then I worked in government. And from government, I got to policy making, and now I'm at WHO, and I've been here 8 years. But my work is a blend of evidence-based science through to how it can be used for practice and policy. So I'm very interested in the translation, and I'm in a very fortunate position of melding both together.
Thank you, Fiona. I learn something new every time as well. And I also forget where you're starting is so powerful. The journey is amazing. So it's fabulous. And I learn something new every time I hear that story. And Stephen, a pleasure to meet you again. I know the last time is that we met in Geneva. I think it's a brighter, sunnier day today than it was was then. But tell us what your role is. How's the World Health Trade Organization operate, and how does this, and likewise your career, connect the dots from where you started to where you are in this amazing role.
Well, thank you so much, Grace, and it's an absolute pleasure to be here with you and Fiona today. So let me start by saying at a fundamental level, I always wanted to work with people, work on helping people advance and perhaps meet their full potential. So after university, where I studied political science and law, I determined perhaps it would be better not to go into the private sector, but do something in the public service. So with a background in law and political science, I started to explore how could I work to really support development. But for me, development was not always only economic or infrastructure, but really focused on people, particularly vulnerable people, and historically disadvantaged communities, of course, including women. So for me, the broader question was, how could you use trade policy or economic development to unlock what I would call the native capacities or capabilities of people? And I think throughout my career, I've been focused on that objective. So initially, I started with the Ministry of Foreign Affairs and International Trade in St. Lucia. I had various stints with the Commonwealth Secretariat, as well as a short stint with the CARICOM Secretariat before I became ambassador of the OECS to the United Nations in Geneva. And now I serve as the senior advisor to the Director General of the WTO. For me, trade policy was and is critical because it's a space at the intersection between economic development and human development, and specifically how individuals through trade can fulfill their talents. So trade policy for me is an area where if it's done right, if governments create the correct enabling environment and the correct policy framework, that individuals could really use that as an opportunity to fulfill their own commercial talents. So I'll end here. I'm hopeful that through this discussion, we can explore a little more detail on how trade policy can be a driver for positive economic, social, and human outcomes.
Yeah, thank you. And I'm looking forward to getting into it more because it's definitely a space where I think a lot of us are trying to get our head around it. And especially as the world is becoming more and more global, what are the impacts? What's coming down the track to be thinking of? But do you want to set the stage for us for a little bit here? And the world of, physical activity health, set the stage for us today. I appreciate most listeners have probably heard some of the stats, but give us the rounded version.
Well, thank you. Of course, there's a long and established scientific basis for the importance and benefits of being active through exercise, sport, active recreation, walking and cycling, and just taking that and calling it physical activity. The field of sport and exercise science have provided us with the benefits that are just across a whole range of mental, physical, and social outcomes. And on the basis of that body of evidence, we can calculate how much it improves health and how much it prevents death. And therefore, as WHO is the technical agency for the United Nations on health, the importance of looking at all benefits to health and risks to health, physical activity has got an important role. One that perhaps has been underestimated in the past because physical activity has only had more recent focus as a policy agenda. The numbers that you invite me to share do include the most recent estimate on levels of physical activity, and we calculate globally using country level data, aggregating it up, and 31%, around about 1 in 3 adults, do not meet the recommended amount of regular physical activity to gain all of those benefits and prevent those diseases like heart disease, cancer, diabetes, and others that we know can be achieved. There is a gender difference between that. That was the average of men and women. And when we break it down to levels of activity in men and women, we see women are less active. And there's around about a 5 to 6 percentage point difference there. But that's on average globally. And indeed, around the world, that can be as wide as 10%. And in some countries up to 20% difference. These are percentage points. So it means that 1 in 2 women can be less active than men in some countries. We also see that difference in children. We can discuss that in our conversation. So with those sorts of levels and rather similar to past concerns that have been focused on tobacco control, we do have the attention on physical activity with the goal of increasing levels of physical activity and addressing that gender difference and also differences we see over age and the differences we see between countries. WHO is a policy and standard setting organization. So very briefly, we provide all countries with the guidance they want and they ask from us on how to address this public health challenge. And very fortunately, of course, there's a great community of the sport ecosystem that converges because they want more people playing sport, participating. And so we have a really interesting and wide and diverse set of stakeholders, which I'm sure we'll explore. Delighted to be here with Stephen, of course, because some of that will interface with how we can, unlock, to use your phrase, the potential of more people being more active, a phrase from our global action plan, through some trade policy, through enabling the environments that will create and assist people to be more active.
And I know, Fiona, as you mentioned, both of you guys are working with the sporting goods industry and the World Federation there. And I know, Fiona, obviously you're doing a body of work as well with like the fitness industry and likewise there. But Stephen, build on that for me in terms of trade and obviously across the world. What is happening? What do we need to be aware of, and what should we be thinking of as we look down, the next 2 years, 3 year strategies, whether it's sporting goods or fitness or equipment side of things?
Thanks for the question. I think traditionally trade and trade policy experts have really been focused sometimes specifically on rules and rule making. and sometimes without a clear understanding or appreciation for the implications of specific sectors and communities. So the externalities of trade historically were not really paid attention to. For me, what is exciting is today, I think the focus in trade policy circles is really expanding to questions related to how can trade help to create a better distribution of value globally. So we're now looking at how can the benefits of trade be more equitably or equally distributed, which to my mind is somewhat of a tacit acknowledgement that during the last phase of globalization, many people and groups of people did not benefit sufficiently. So we are now championing how we could use trade as a driver for example, women's economic empowerment, for environmental outcomes which are positive, etc. These were areas, to my mind, which had been excluded from previous dialogues. Right here at the WTO, we have recently launched, for example, a fund, a $50 million fund, which is aiming to support women's economic empowerment. And the objective of the fund is to help train particularly women and enable them to access the global market through digital tools and platforms. We are also, with respect to rules, advancing discussions on thematically within many of the different files at the WTO. And as you are aware, I'm personally involved in a very exciting project with FIFA and other partners called the Partenariat pour la Coton. And we are hoping to work in West Africa. We've already started that work to help the cotton sector transition from primarily exporting cotton fibers to moving into the value-added sectors. So moving from exporting cotton in its raw form to garments and textiles, which of course is additive in value. We are particularly interested, not only because of the economic value, but the opportunity for more women, more young ladies, more young men to be engaged in a sector which could provide them with some measure of economic sustainability and drive outcomes which we believe are important. So in sum, I think we're looking at questions of equity. We're looking at questions of how trade can foster better social outcomes and how trade could be a tool for economic inclusion and respond to the climate crisis.
I love the way you connect those dots between climate crisis, ultimately looking at empowerment and leadership and obviously products and across the world. Fiona, they obviously all play in, and likewise, all of these things overlap because nothing operates in isolation. As you look at parts of the world, is there you mentioned a few differences there between 5% to 20%. What parts of the world are doing this well, do you think? And where do we need to maybe lean in to get those numbers to be more equitable for not just for women, but for genders regardless?
Yes, well, I mean, talking about the participation levels again in adults, there are variations around the world, and there are countries which are, we could call more active, and many of those are in the European region as well as in the West Pacific area. And then there's some anomalies where we're seeing some of the Asian countries with much higher levels of inactivity than maybe might be automatically expected. And then there are regions which are notably lower, and we look into some of the Middle East have got countries which seem to top the list of higher levels of physical inactivity and the widest gender differences. So it's described in our own report as very uneven. And rather worryingly, we also describe the progress to address it as slow. So we have the convergence of the perfect storm. We have widening and poorer levels of physical activity as we track trends over time. They're going in the wrong direction, and yet our response has been slow. And picking up on Stephen's dimensions of which seem a long way away from what many would think is the promotion of physical activity. The reason I'm excited by this conversation and the potential of future directions is because we have to move from seeing this as an individual problem. And just like in the areas of obesity and overweight, and in many other health areas, we have to see the whole ecosystem. And sure, there's always the individual's rights to choose, the individual preferences and differences, but it is a systemic problem. And it starts in childhood, about having the access and opportunities to learn and enjoy, and then to continue to be active and play and have the opportunities in a sporting way, not just at the elite level, but opportunities to sustain and participate in ways that reinforce rather than drop out. And we've got to look across that system for the intervention points. And too often we've just looked at the individual. Let's tell them a bit more, motivate them a bit more, encourage them a bit more. It's not enough. What's the really larger drivers is employment, because we know and see patterns that people who are employed have got more economic resources to be able to therefore have time and indeed opportunities, as the financial barriers to participation do exist, often more for women than for men. And so I'm really excited of the future, where we are now, and our eyes are looking at a systems approach, beginning to work across the system with all sectors, public and private, at different levels of that system. And at one of the highest levels might well be trade and determinants at the larger scale. So exciting times.
And you're just to make sure everyone's listening, that the system approach there is absolutely crucial. And you said, we talked before we started, you deal with a number of government departments as well as private. So give us a few of the government departments that you engage with on a regular basis, to give us from a top-down, maybe a tiered approach as well. Who are they?
Yeah, well, you'd think that, and you're quite right, that WHO works with ministries of health. So in the government, it's absolutely the health, to ensure there's recognition on the role of the physical activity. Again, I'm using that as an umbrella term for all the ways: exercise, fitness, walking, cycling, sport. But it's not enough, because, of course, the ministries of sport or youth and sport are equally important to play a role, not just at the upper end and the elite end, but all the way down to the community. But actually, as I mentioned, walking and cycling, ministries of transport are really important. They are the ministry that will decide and determine how and the mobility systems of our communities enable and provide for walking and cycling. But they need the help of the urban planners and land use, because if the road space doesn't allow for a separated cycle lane, we don't get one. And then we need local governments to make sure they're maintained. But leisure can come part of this, because more and more sport and leisure, tourism, and of course, I haven't mentioned education. Earlier, I commented on the importance of a good start to active living from childhood. And we do see early differences by age 5 to 8, girls and boys already beginning to show difference in competence and enjoyment, and therefore participation. So I've mentioned across quite a number of the government departments where it's vital they're involved. But let me emphasize, though, Grace, there's benefit. We're not asking them to do the work of health. It's their business as well. We want better education outcomes and kids staying in school and enjoying it, learning better. And we know by having physical activity, physical education, kids learn better. It's good for the transport system to have short trips made by walking and cycling. It's good for the environment. It's good for the economy, as people who walk and cycle will stay and spend in local communities. I could go on. So it's very much about seeing, as your podcast here is, connecting the dots. It's about working together for common and shared goals. And that is still challenging as governments work in vertically and fund vertically, and perhaps have not seen the intersect as clearly, and that hasn't been enabled enough. There are some examples around the world, and we hope to help countries, many more countries, achieve that.
So, Stephen, on the back of what Fiona shared there and the number of departments that she works with WHO, what are the departments that you also work with that layer into this complexity between horizontal working and vertical working? How does the WHO integrate?
Thank you so much for the question. So there are many departments that we interface with. The first and principal one would be the ministries of trade. However, we do work with the ministries of health on matters related to sanitary and phytosanitary measures. We work with bureaus of standards relating to TBT, technical barriers to trade. We work with ministries of commerce with respect to matters related to trade facilitation, as well as customs and excise on matters related to trade facilitation. So we work across governments, but our principal focal point would be the ministries of trade. I know that there is a growing perception that the WTO rules are important, but there's a movement towards more bilateral and free trade agreements. However, I think it's important to note that 80% of global trade takes place on WTO rules, what we refer to as most favored trading rules. And that creates a certain level of predictability and transparency in the rules governing trade. So this remains very important for commercial enterprises in their own engagement with non-national traders. We're also working very keenly to make trade easier. We've delivered an agreement a few years ago on trade facilitation, which has tried to strip away some of the difficulties which one trader would encounter at customs and excise. So there's more transparency, there's more predictability in terms of what traders should encounter. We're also working, a specific group of members are working on an agreement on investment facilitation. Again, that should, when it comes into force, provide a greater level of transparency in terms of what the investment climate is, so that there's a clear understanding of what an investor should reasonably expect when that investor makes a capital allocation decision. So we are doing a lot of interesting things which would allow the businesses to benefit from the international market. And we're hoping that in the years to come, we would continue to deliver to our members.
It's really complex, Steve. So thank you for helping to simplify it down to a point, at least where us mere mortals can understand it a little bit and get a sense of how does it all operate. And you've both been able to connect a lot of dots there between just the normal day-to-day things that we do, whether it's getting up and going to school or going to work. Obviously what we're wearing, whether it's running gear and where is that made and how that comes across, and likewise activity through clothing, sporting goods, as well as clubs and whatnot. I'm conscious that we're in a very global world today, right? It's obviously, I think it's easier when we think about physical products and trade. But Stephen, a lot of the time, I'm accessing, say, digital technologies and so on. And obviously we've got a change in trade happening, as well as tariffs, and all of tariffs, probably the most popular word right now being Googled at the moment. What's your sense of changes in the next 2 years, 3 years, 4 years? Is there anything that the sporting goods industry or the manufacturers of fitness equipment or anything in physical activity, the hardware, should be conscious of, and or software? If there's anything that software companies should be thinking of from a trade perspective?
Thanks for the question. So there are two principal areas that may lend themselves to further engagement by members, which could touch and concern on the sports industry. The first one is the e-commerce negotiations taking place at the WTO, which hopefully at the end of that process would provide, let's say, electronic solutions, the watches, which would, and fitness equipment. Now more and more fitness equipment is electronic. So that could provide a basis for the platforms which could help advance better lifestyles, both in terms of the consumption, nutrition, as well as exercise. So hopefully the agreement on e-commerce could help expand the range of opportunities for platforms to provide those services digitally, which could have positive health outcomes. Another area which has not yet started, but potentially can, is members have the ability to engage in negotiations with specific outcomes. For example, we call them sectoral initiatives. There is a possibility that certain members could determine that they can look at specific health-related products and lower the tariffs, lower the barriers to trade on those specific tradable goods, so that they would be more broadly distributed and the health benefits could accrue more broadly to the global community. Again, this is something which would be within the gift of members to determine. That has not started yet. But of course, anyone listening to this podcast, if you have the influence or the ear of your government, you may want to explore how some sectoral discussions could be advanced to ensure that health products or products with a health benefit can also be seen or for further liberalization and reductions in barriers to trade.
And to your point as well, employment, sustainability, all of that overlaps because, and as Fiona mentioned, employment leads to having disposable income, which leads to having the ability and the access to opportunities as well. So there's this underground, the system approach is quite important. So good call out, Stephen, for those listening. If they have influence, we'll absolutely be asking them to lean into that. And on that, Fiona, if everything was possible and you were saying to the audience listeners today where they could lean in, is there any top 1 or 2 or 3 priorities that you'd be saying, lean in here because this is where we might be able to get great impact? Is there the magic wand? What does that look like?
Oh, wow. Well, that's an exciting question, but also somewhat unexpected. Look, there's that's very challenging. But let me start my answer by picking up on a couple of opportunities which even Stephen just laid out there. I mean, we do want to make sure that health-related products and those that are positively enhance health are more equitably distributed. And so the opportunity that we all just heard there is that we need to look at any barriers to the distribution or inequity of distribution of health-related equipment. And in the area of sport and exercise, physical activity, my go-to example is to think about the bicycles. And, we often think that everyone's got a bicycle, but no, and there's some wonderful initiatives that we should give a shout out to in terms of promoting access and affordability and a robust design to work in the environments and context, but most importantly, being at a price and being available. This shouldn't be a charity. This needs to be a sustainable system that needs to support all. Many in the industry, the cycle industry, are trying to advance this, but access to bicycles, and then it can have a really transformative effect, not only for health as people use them to get to health services, employment and education, and to engage in community and economic activities. So I'm really interested in working with World Trade Organization and exploring some of the potential existing barriers, but also where that could be facilitated in more ways. That's just one example, and I'm sure there are others which the audience can think of in terms of goods and services. And I'd like to pick up the second point that Stephen mentioned, and that is in the area of e-commerce, because one of the exciting agendas we have, and it's already flourishing, is the use of digital tools to promote physical activity, whether we're wearing it on our watch or on our finger or on our hip. These different devices of different names and different componentry are providing new and exciting ways for monitoring what people are doing. It's giving us instant feedback. So gone are the days where we didn't quite know how active we were and we relied on our own recall and perhaps our slight bias in favor of being not so, remembering how much we did. Unfortunately, the things we wear now can give us the truth of the matter in terms of what we're doing. But our concern about those goes back to our normative and standard setting role, and drawing on the research and the interface between research policy and practice. We don't know which ones to recommend. We don't know whether they're actually measuring. We don't know whether we can compare between brand A and brand B. We know they all promote the quality of those. They're all at certain price points, so they may only be accessible to some. So one of the areas of interest, very current area of work we've got now, is looking at electronic devices for supporting physical activity in both measuring and then behavior change and incentivizing. And I think that window is wide open, but critical is partnership between public and private and academics. The technology changes so fast. We can't do a randomized control trial and apply for a 2-year grant. Gone. The technology moves on. So we need to have a new model that can be interactive, real-time research where quality data, independent analysis can be simultaneously as products develop. and in the public domain, because of course those in the private sector know that's what we do. Well, unfortunately, we don't know because we don't get to see. And so we're very much looking forward to inviting and engaging in conversations with public, private, government, non-government academics around how digital tools can really help close the gap. And the gap I'm talking about is the gap between men and women, girls and boys, and the gap between the potential of physical activity to contribute to public health and where we are today.
And I love the way you called out the kind of the evolution of science and research and the evolution of tech. To your point, it's quick, and it's very quick right now. I mean, I think RCTs, great and all as they are, but as you rightly said, in the world of tech, they're a little bit obsolete by the time they're written. The proposal's written, the software is moving on and the hardware is moving on. So never mind the 2 years to do it, and then the analysis and whatnot to go with it and publication. So yeah, that's and the NICE guidelines, to be fair, in the UK acknowledge that as not being best practice in terms of software. So I think that's a great call out. Stephen, anything to add to that as you think about likewise trade and obviously the complexities to go with that? Like research, I'm assuming you're the same. There's a bit of learning on the go here as the world of globalization opens up and the world of tech opens up. Software can be deployed anywhere and pretty much any moment. It's thankfully not hard to deploy a software and app. Good example across the world, every app store, every country pretty much, has one and easy accessible. Are you seeing that's helping?
Yes, I do think it's helping. And I think at the initial part of our discussion, we spoke about moving from rules making and looking at the externalities. And I think now there is more of an appetite to explore specific outcomes. And of course, we could look at how could trade, working with the WHO or other partners, how could we help deploy more bicycles, more sports equipment, exercise equipment, digital devices which promote healthy outcomes, nutrition, which would be beneficial. I think that there is space now, given the fact that members are more inclined to look at trade, not only at a very high level, but looking at specific outcomes to explore how we can help use the WTO, use rules to advance outcomes which are beneficial. And of course, I wanted to double click on what Fiona had just said in terms of digital devices, which are really important, not in terms of monitoring physical exercise, but could be an important diagnostic tool, which could predict certain health-related risks. So again, trade, health, there is a natural symbiosis. And I think we could look at exploring how we could deepen a relationship, which would lead to trade outcomes which are beneficial, but also health outcomes. But as I said in your previous question, we're a member-led organization, so it's not only for the Secretariat to decide on the clear path forward, but for members to determine that is the direction of travel they wish to take.
Yeah, let me jump in and say that's the same, of course, with WHO, and we're a member organization with the representatives of the ministries of health from 194 countries. But you've very nicely picked up on my omission of the potential for these digital devices, tools and interventions to support what is a pressing global health problem, because physical activity contributes to reducing non-communicable diseases, some of those I listed, and they are the largest cause of death, and particularly premature deaths. So the audiences may know that it's nearly 3/4 of deaths are due to non-communicable diseases globally, and that's 41 million a year. And many of those could be prevented because they're occurring before the age of 70. And these are preventable. And that's the focus of the SDG 3.4, a third reduction in preventable deaths from non-communicable disease. So the interface now between how physical activity can support disease prevention and management of those people living with diabetes, living with hypertension, but we need trust in the devices. We need to ensure that they are reliable, accurate, and providing and fit for purpose. And there's another place where some of our work is now turning to the norms and standards around those device specifications. So going back to your first question, Grace, where I came as a physical education teacher, little did I know I'd be talking about ISO and device standards that might enable a doctor to give the advice to patients with confidence, reliable, and a way of measuring which can help the patient and their health systems. So this field continues to open up opportunities and alliances in new ways.
And it's interesting, to your point there, Fiona, every time I'm on this podcast, I end up talking about the business opportunity with the idea that even if someone's not into the world of health or fitness, at least I'm kind of going, well, there's a business opportunity. Money makes the world go round, we get it. But the opportunity to support, as you said, 1 in 2, if not 1 in 5, more, it's huge. It's absolutely huge. It's really opportunistic from a business perspective, but also very impactful across the world. And then the economics make sense at every single turn. And we're all paying taxes towards health systems and infrastructures and everything else. And, it's a win-win-win. There's literally no negative, I think, to leaning in, unless you guys can tell me otherwise. Leaning into health, physical activity, employment, sustainability, I appreciate there's some costs to businesses around infrastructures and putting that in place. But, at the end of the day, the long-term gains are phenomenally greater than the cost short term and upfront with it. So I think, and I'm lucky, as like you said, Fiona, I'm currently in Netherlands. Thankfully, it's got a great infrastructure around cycling. But I do also appreciate, as you rightly called out, and Stephen did the same, around, economics are a huge factor here. The more, the more money you have, ultimately, the more access you have as well to devices, software, and opportunities. So the economics are phenomenal difference across the world, and phenomenally important. So yes, so to call out to those, whether it's manufacturing hardware devices or manufacturing software devices, affordability is absolutely key, and making sure that we're getting science in place for that personalization as much as possible, but doing so in a way that makes it affordable and accessible to pretty much everybody is a key aspect, and needs to continue to be a key aspect of strategy for businesses. Right. Stephen, do you want to jump in on that?
No, I have to agree with both of you. And again, if you have a trading system which functions well, then you will be able to hopefully bring down the prices, rather than each country taking responsibility to manufacture digital devices or some of the equipment that we speak of. If we have a trading system which is effective in terms of distributing those very important health-related devices and equipment, I think we would, of course, have better outcomes. So I want to only agree with both of you.
I think Fiona, oh, sorry.
No, go ahead, Fiona.
Well, I'm certainly going to agree with you that there does appear to be no downsides, and that's the collection of multiple benefits that are all intersecting from health to the environment to the economy, of course, is where the concept of well-being is going. And this is very much a priority of WHO, where we do protect health from these emergencies and unexpected events, but also how we can promote health and well-being. And it's that human environment and planetary health that is really the big shift that WH is going through. And it all requires, again, going back to earlier comments, us multiple sectors have got a contribution to make towards that, from technology, machine learning, digital, all the way through to the sports industry, sports manufacturers, exercise and fitness in my area, which is physical activity. And I acknowledge, of course, the nutrition area is equally important for promoting health and well-being. So we have an enormously long way to go, and I suppose that's the catch here. There's so much potential, but there is a long way to go. We're off track for the SDG 3.4. We have rising burden of disease according to attributable to non-communicable diseases and the risk factors. Trends happening in the area of alcohol and tobacco, which are worrying in terms of growth in those areas which are unhealthy and leading also to non-communicable disease. But we're at a crossroads, and if we can harness the opportunities, certainly public health will benefit, the environment will benefit, and we'll start with living within our means of the planetary health.
If I may also jump in here, Grace. Well,
Please.
I do think that the scalability of digital tools can help those tools be better distributed more quickly. They're scalable, they're adaptable to countries at different levels of development. And I think the force multiplying effect of, for example, artificial intelligence now also provides a unique opportunity. So whilst we are behind, let's say behind in terms of making progress to the SDG outcomes, which Fiona mentioned, I do think that the tools which we are more and more having access to help us to move quite quickly if we put our collective will behind those initiatives.
Mm. Mm.
Yeah, thank you for that. One thing that I know that a lot of countries are working on is also around the tax and the tax rate for health solutions and everything there. Fiona, do you have some insight to share on that? I know Ireland is a good example where they're working with the government around implementing ultimately a savings and a reduction of tax costs on health and fitness and wellness and physical activity services. How is that looking on a global basis? What can you share?
Yeah. Yes, well, certainly listeners may be familiar with long-standing tax on tobacco, which has actually been beneficial where those resources are then reallocated to support promotion of health and particularly the replacement of tobacco advertising and sponsorship in the area of sport, to name one. And so we often refer to them as health taxes because they are taxes for good. And that has now expanded into what many audiences would be familiar with, and that is a tax on sugar-sweetened beverages, the SSB tax, always underpinned by science that the product in focus has got a detrimental effect to health that's been assessed and quantified, and that the impact of an intervention, as in a tax, has the appropriate and it intended impact on the consumption and therefore then health outcome. And this is a direction that's absolutely being a focus of WHO's policy work. Indeed, we have a team and experts that are now supporting many countries explore what they do now and how to reform those legislations, tax provisions to benefit from this. In the area of physical activity, there's not yet something we could call a tax, but certainly there are, I think, in the era we're moving into with concerns of climate change, the impact, air pollution, some of the emissions, it's not inconceivable. And conversations are already starting about how can we hypothecate a tax to start supporting some of the shift towards sustainable mobility. We go back to our bicycles and walking, public transport systems, where we can use those levers in the economic marketplace to favour the behaviours and patterns that will be health enhancing for all. So that is a very exciting area. And then, as you alluded to, there are some initiatives that are taking place to provide some individual or to the employment organisers, private sector, to implement some of those levers where they can. And I think this all should be explored. And to date, we haven't got a place where we talk and hear about those. So a really interesting idea for the very near future would be to see what forums can be created where these are the focus of discussions. Whereas historically, Grace, and I know you come from this field, you'll remember where we're talking about the health benefits and the science and measuring cardiovascular fitness. We've done our job there. We now need to move on to really looking at the levers in trade, tax, policy, regulation, so we can get the wider system enabling the health and well-being, physical activity, healthy diets, and health more generally.
Stephen, do you want to add to that? Because I appreciate we're talking a lot about where your focus is at.
Yes, no, I mean, of course, in terms of domestic taxation, we don't have competence in that area, but certainly trade taxes, border taxes, we do have, of course, we do have competence there. There is an old saying that you show me an incentive and I could tell you what the outcome is. And if the incentive is to increase level of exercise, physical activity, better nutrition, access to devices which could both serve as a diagnostic or other health related devices, I think if we provide the right incentives, whether it's in the domestic space or through lower barriers to trade, lower trade taxes, then I think we could sort of assume what those outcomes would be. I think the WHO has, I believe, maybe Fiona could correct me, already started modeling what the impact could be of lower costs of trade in some of those products. If it hasn't, then I think this is something which could certainly be explored to see what would be the net, not only economic, but health benefits of providing those incentives, which is lower taxes, both in the domestic space as well as free taxes, and what that impact could be on individual outcomes. Again, those outcomes would be health, environmental, and well-being more generally.
Yeah, I'm afraid there's no current work on that in the area of physical activity, or those modelling exercises may well be taking place in the area of the tobacco, alcohol and diet. I invite that opportunity and way forward, Stephen, and to the listeners.
What's interesting is, as we talk about, when both of your stories started here about education, law, economics, when we think about the silos of industry, and I say about this in terms of globalization, part of the reason for the podcast is pulling together these different areas. And we've all talked about this before. So we have the silo of sport, sitting in one space, fitness in another, technology in another. And part of what I'm trying to do with this podcast is break down some of these silos, because to both of your points, many times there's an overlap and there's an intersection at all of it. And it's too complex a world we live in for these silos really to exist where they operate in silo effectively. So breaking down silos is quite an important aspect for industry, as well as for governments, as well as for us to lean in to government and help persuade and, I suppose, amplify what our knowledge is. And what's interesting is, that we've got people across the world who are starting as engineers who don't see themselves as in the world of health and fitness, but actually they could very well be leaning into a solution. Or law, again, back into where Stephen is his career's path as well. So it doesn't actually matter whether you're a teacher, whether you're whether into manufacturing of hardware, whether it's engineering. There's just a complement of pretty much every single person in the world has potential to be leaning into the solution for health and fitness and globalization in that space. So I think that's one thing to make sure I think we call out. And part of that is what I'm conscious, again, you guys have got fantastic careers. So let's plug on that for a little bit. When we look at people looking at the industry and they're passionate about health and they're passionate about physical activity and passionate about equality, and gender balance in these spaces, and they think, well, I'm not really in this industry, so I can't do a whole pile. Fiona, give us some lessons that you've learned over the years as you've evolved into being, the amazing leader that you are. What are potentially some of the lessons that some of these other career paths might go, that's a good lesson, I should think about that or lean into it? Or what would you like to share so they can be the next Fiona Bull?
Oh goodness. Well, of course, I encourage everyone with an interest in this area. It'll be a journey of unexpected twists and turns and opportunities, and I certainly do suggest that listeners who are ambitious and wish to enter this, take risks and explore your entry point. If you feel like you're outside, I concur with you, Grace, that there are so many ways to get involved in this field from multiple, in fact, more from outside of health than inside, despite.
Right.
But in terms of then in the career, I think looking for those opportunities of how to connect with others in a different discipline. I think that widening of your perspective, and my own career has looked from a sport perspective into a health perspective. I spent nearly a decade looking at environmental design, urban design, of how many parks we need in cities and what the design of a park should be and how to increase the walkability of cities. So diversifying, but always, I suppose, seeing threads. I do a lot of mind mapping of connecting points. As many of my colleagues would know, I'm probably most seen with a paper and pen drawing, because I see links and then explore them on the fringes, not taking one's eye off, of course, core and more obvious direct ways. But that's one lesson. From a gender perspective, I think I've experienced fields which have have had their gender imbalance in the areas I studied. I was the first cohort of studying physical education at the university I went to. Prior to that, it had been men only. So they had to build the women's changing rooms for us. So that was an interesting time. And then we couldn't learn netball because you need an opposition and there wasn't enough girls. So we then had to wait for the second year to come in. And then they worked out we could play with boys and boys could play netball. And I'm going back a few decades, but some people might enjoy those little anecdotes. But in the area of health, there is a lot of women in this field, but a notable and continuous difference between the levels, and senior management and higher levels of leadership still have gender imbalance. So we still need to work on that, but we need strong people prepared to contribute. And of course, it goes without saying, be expert in your field, but look to learn and look to partner.
Love it. Fiona, amazing lessons there. Stephen, likewise, you never started, I think, your career looking at possibly the world of health, but clearly are making a phenomenal impact and have done so far and more to come. What's the lessons you'd like to share for someone looking at your career going, I'd like to be the next Stephen?
Oh. I'm not sure they want to be the next Stephen, but if they would like to be, I think there's some values which I would like to share. I think one of the major benefits in terms of working in institutional setting internationally is to balance one's own perspective on addressing a problem with the perspective of others. Specifically, if you're in a leadership role, getting the perspectives of those who have entrusted you with leadership. And that could be at the top, it could be in the middle, it could be at the bottom. So balancing your own perspective, passion, and view of a problem with that of others. I think for me, I would call that a stakeholder approach to leadership, getting as many people on board. And I think another fundamental aspect required for good and effective leadership, and not only a leadership, but achieving outcomes or good positive outcomes, is relationship building. And it's not necessarily only transactional approaches, but building true and durable relationships, I think really would help not only in the immediate objective, but in future objectives. And using those relationships and trust building to find common outcomes, I think it's very important. In the WTO, we have 66 members now. And of course, they come with 166 different national positions, different approaches. Unless you are able to develop durable, true relationships, looking at problems from the vantage point of your opposite number, understanding what their concerns and constraints would be, it's very difficult to find common solutions. So for me, leadership and decision-making should be based on principles. It should be founded on a stakeholder approach to finding outcomes which are durable and beneficial to all who are at the table. So these are the principles. I think these are the moral and ethical principles, which I'm hopeful that I can, that will be beneficial. But I think also you need to measure. It can't be just looking at principles and ethical approaches to leadership and taking on advice from others. But I do think that in addition to that, there must be an effective way of measuring outcomes. And a few years ago, this venture capitalist and author John Doerr wrote this book. I think it's called Measure What Matters. And in that book, he looked at ensuring that in every pursuit that you have clear, measurable objectives, and you're able to measure those results as you go forward. So he, I think in that book, popularized this approach called OKR, which is looking at the objectives and sort of measuring the outcome. And I think that is important. So having clear principles, ensuring engagement of all stakeholders, listening, building trust, building relationships, and ensuring that you are focused on those outcomes which you could measure. Maybe you might not get to the outcome that you desire, but you could certainly measure your progress towards it.
Love it. Some key call outs there. And I mean, last question, really. I mean, thank you both, first of all, for your leadership in this space. And I appreciate, I think hopefully the audience also appreciate the complexity that you guys are dealing with on a day-to-day basis. Even just mentioning the number of of government organizations. And first of all, members, as you mentioned, as countries, right, or members that are there, as well as not only that, but then the number of departments within that. And you've got competing and conflicting objectives and so on there. So it's a phenomenally complex area. So thank you for helping, I think, to share a little bit of the nuances, and I think hopefully inspire those listening to go, I can understand enough now to see where I can possibly lean in and support, whether it's talking to, the local Ministry of Health and leaning, whether it's in research, whether it's in schools and so on, because we want everyone to take away some action that they're going, I'm part of the solution. And I can see somewhere where I can be part of the solution, because I think we all need to be part of the solution. It's not a simple problem, and it won't be one solved overnight for sure. And I know there's plenty of measurement happening, at least on Fiona on your side, but lots to happen more in different parts of these complex system as well. Last question then for you guys, and as you are great leaders, help me call out and spotlight a few other leaders in this space that are worth shouting about, so that we also become aware of who's doing amazing work, who's helping to also change the future, and ultimately make our lives, as well as our kids and nephews and nieces and all of the next generation's lives better as well. So maybe Fiona, you first. Who would you like to spotlight?
Well, I certainly think you emphasize the complexity of who we work with, but indeed that's one of the joys and as well as the challenge of our workspace. And it's not only just within the complexities and diversity of government departments; it's the sector as a whole. And so we look at some of the leaders who are in the sports manufacturing area, and there's leadership now in really engaging and bringing the voice of the sporting world and the World Federation of Sporting Goods really coming up to the platform and saying we need to support this and have voice. And the leaders there are really showing great progress in recent years, and particularly the last year. I also think on the other side, in the non-government sector, the civil society and those leaders who are in the leading the societies and leading the organizations who are providing and implementing programs, whether they're sport for good, sport for all, sport for peace and development, physical activity and movement. There's so many leaders, and I like the way you point out leadership at the highest level, but also leadership in community delivery as well. And then there's leadership in the sport sector and the sporting governing bodies, and they should also see their contribution, and there are many there. So I'm not naming names, but I'm pointing to the sectors and those in them, that they are being seen of the work they're doing, and anyone in those sectors can play a great role going forward.
No, and thank you, Fiona. And thankfully, I think a lot of the people that we've worked with together over the years as well are also on different podcasts and sharing their perspectives and what they're doing. And it's fantastic. So yeah, we've a big group of people in that you mentioned there. So we'll all keep going. Stephen, do you want to call out or spotlight someone from your side of the world?
I'm going to cheat and mention two names.
Please.
First of all, my boss, Dr. Ngozi, she's demonstrated throughout her career tremendous work ethic, really strong talent, an ethical leader, someone who is always fully committed to beneficial outcomes which would benefit people. I think this balance of very firm but also very empathetic person. So I'm a big fan. I'm not only her advisor, I'm also a big fan. And double backing on the question of inclusion, she's been one of the main proponents of women's economic empowerment. And in a way, given the establishment of the Gender Fund and other initiatives, she does not only talk, but she walks the talk. So I'm a big fan, also advisor.
Excellent.
Another person who is a young lady from my native country, St. Lucia, Julian Alfred, the fastest woman in the world. She won the 100 meters in Paris at the Olympics. Another individual who has had many challenges, overcome many challenges, and is now on the global stage, making my country proud. So Julian Alfred and Dr. Ngozi Okonjo-Iweala.
Fantastic. Great shout outs. Absolutely great shout outs. And I think it's lovely, Stephen, to hear men like yourself as well sharing, their leaders and who they're advising and working with closely as phenomenal leaders. And, we're definitely working towards, gender balance and appreciation there. We have a bit to go, let's be fair, in terms of statistics. But we do appreciate the men like yourselves that are working as well as actively, intentionally working through this as well. So thank you for that. Guys, I appreciate we could talk all day. As I said, I know you both have complex roles and also complex problems to solve on your desk. So I appreciate you taking the time today. Hopefully, the takeaway action for those listeners is having the inspiration from what you've done in your careers, as well as the takeaway action of what they can do themselves in order to be part of the solution. There's a lot to happen, a lot going on. And we will hopefully continue this conversation as well. And I'd love to get you guys back at some point where we're looking at more success stories and more changes that have been impactful and in more calls to action. So it's an open dialogue for all involved. But again, thank you both.
Thank you, Grace. Thank you, Stephen.
Thank you, Grace. Thank you, Fiona. Thanks for the opportunity to have this really important dialogue.
Thank you for listening. You can connect the dots with others by sharing this podcast with colleagues and teammates. At wearethecollective.world, you can join a professional network, avail of professional development, and engage your support team. We collaborate on the shared pursuit for gender balance in health and business. Until next time, keep connecting the dots.